If you're here, you're probably dealing with that awful, sharp, zapping pain down your leg. And you've got one big question on your mind. Is this sciatica or a herniated disc? And the even bigger question, do I really need to get a super expensive MRI to figure this out? Well, what if I told you the most important clues aren't on a scan at all? They're already in your own body. And today, we're going to help you learn how to read them. This quote from our source material just nails it. The whole point of this explainer is to help you move from that feeling of panic and not knowing what to do to a place of empowered observation. We're going to give you a system, a way to listen to what your body's already trying so hard to tell you. So let's get this straight once and for all. What is the actual difference here? Think of it like this. Sciatica is the symptom. It's that pain, that tingling, that numbness zinging down your leg. It's the annoying radio static you're hearing. A herniated disc? That's just one possible structural cause. It might be the broken antenna that's creating the static, but it's not the static itself. Getting that difference is the first huge step to taking back control. So that's our mission today. We're going to separate that nerve irritation, the static, from its potential structural cause. The idea is to replace that feeling of panic with pattern recognition, because recognizing the patterns is what really tells you what to do next, not just how scary the pain feels in the moment. All right, so let's put on our detective hats and start the investigation. We're going to walk through the exact clues you can start looking for today and turn you from someone who's passively worrying into an active investigator of your own symptoms. First question, and it's a simple one, but it is so powerful. Where exactly does the pain travel? The route that pain takes is a massive diagnostic hint. So don't just say, oh, my leg hurts. Get specific. Trace the map. Okay, let's break down the first 3 clues you're looking for. Clue number 1, a classic sciatic pattern will often track from your buttock, down the back of your thigh, and right into your calf or even your foot. Clue 2, if your symptoms are traveling below the knee, the chance of direct nerve root involvement goes way, way up. And clue number 3, a herniated disc usually picks a side. One leg becomes the unfortunate star of the show. Okay, next question for our investigation. What specific movements or positions really set this thing off? Your body's reaction to physical stress is, honestly, one of the most reliable pieces of evidence you can possibly gather. Let's look at 2 huge motion triggers. The first is what our source calls a truth serum, sitting. If you sit down and after about 15 to 30 minutes that leg pain reliably fires up, well, that's a big pointer towards a disc issue. The second is that dreaded cough or sneeze spike, that sudden, sharp jolt of pain that shoots down your leg. If you know what I'm talking about, that's another really strong signal of disc-related nerve irritation. So we've talked about pain, but now we're going to level up to the next set of clues, the neurological signs. It is so important to know the difference between something just hurting a lot and actual true numbness or weakness, because these 2 things mean very different things and require closer attention. Here we're looking for 2 really specific things. First, any loss of sensation. Is there a consistent, stable patch of numbness that pretty much follows the same route as your pain? That's clue number 6. And for clue 7, we're looking for true loss of muscle control. We're not talking about it hurting too much to push. We're talking about an actual inability to control the muscle, like your foot literally slapping the ground when you walk. That is a sign to take very, very seriously. And on that note, we need to pause. I need you to really listen to this next part. We're shifting gears because there are some signs that are completely non-negotiable. These are signs that mean you need immediate medical attention. Just let that sink in for a second. Red flags, they override every blog post, every video, every piece of well-meaning advice you'll ever get. What we're about to talk about is not a wait-and-see kind of situation. These are the red flags. Number 1. Any new loss of bowel or bladder control. Number 2, numbness in the saddle area. That's the parts of your body that would touch a saddle if you were sitting on one. And number 3, weakness that is clearly and rapidly getting worse. If you experience any of these, this is an urgent care now scenario, period. All right, assuming no red flags are present, let's talk about the big one, the MRI. Beyond all the clinical clues, we have to talk about the real-world questions of time and money, and whether that scan is even the right move for you right now. This quote right here is your North Star. Don't get an MRI just to scratch an itch of anxiety. Ask yourself this one simple question. Will the result of this scan actually change my treatment plan right now? If the answer is no, then it might be smarter and cheaper to wait.
So, to help you make that call, here's a simple little yes-no check. 1. Is any weakness you have getting progressively worse this week? 2. Have you tried conservative, sensible care for about 6 weeks with little to no improvement? And 3. Are any of those red flags we just talked about present? If you're answering yes to any of these, an MRI starts to look like a much more valuable tool.
And hey, if you do decide an MRI is the right next step, this slide is your new best friend. Seriously, screenshot this. It's a prep list for your calls. Having this info ready before you call your insurance or the imaging facility can save you from a massive financial headache down the road. It's all about being prepared. Okay, we have gathered a ton of clues. We've talked about the big decisions. Now let's build an action plan. It's time to turn all this knowledge into clear, concrete steps you can take over the next 7 days. Here's the plan, broken into 3 really simple phases. For the first 2 days, your only job is to stop doing what hurts and start logging your symptoms. That's it. Days 3 and 4, you can start to add in some gentle, pain-free mobility. Then, for the last few days, you carefully test your tolerance to different positions. Look, the goal here isn't to fix everything in a week. It's to gather clean, undeniable data for yourself and for your doctor. And when you do go talk to your doctor or physical therapist, this is how you make that short appointment incredibly productive. You just use this 4-point summary. You clearly state the pain's root, the triggers that make it worse, how it's affecting your daily function, and the timeline of the whole thing. A summary this clear makes your story impossible to ignore. This is just so powerful, right? The person in our source material found that even though, the MRI did end up confirming a disc problem, the real victory came way earlier. It was that psychological shift from feeling totally helpless to feeling in control because they had a system. That is the real win here.
So we'll leave you with this final thought. An MRI can be a really useful chapter in your recovery story, but it's rarely the whole plot. Your body is telling a detailed, complex story through its patterns, its triggers, and its responses every single day. The real question is, are you listening?